Prostate cancer, what every man needs to know. My friend's dad, a healthy 58-year-old who never missed his morning jogs, thought he was just getting older when he started having trouble with bathroom trips at night. By the time he finally saw a doctor, what could have been caught early had already spread. Don't let this be your story. But here's the shocking truth: this is preventable. I'm about to share information that could literally save your life, or the life of someone you love. If you're a man over 40, or you love someone who is, you need to watch every second of this video. Let me present some facts that will change how you think about men's health. 1 in 8 men will face prostate cancer in their lifetime. It's the second leading cause of cancer death in American men. But here's the game changer: when caught early, this cancer has a nearly 100% survival rate. Let that sink in. We're talking about a disease that's almost completely beatable, if you know what to look for. I want to tell you about 2 men. Both 62 years old. Both were diagnosed with prostate cancer in the same month. John went for his routine physical and caught it early, stage 1, confined to his prostate. Today, 5 years later, he's cancer-free and just became a grandfather. Mike. He ignored the symptoms for 2 years, thinking he was just getting older. His cancer had spread by the time he finally got checked. While he's still fighting and receiving excellent care, his journey has been much harder. The difference? A simple screening test. So, what is prostate cancer, and how does it develop? The prostate is about the size and shape of a walnut, roughly 1.5 inches, 4 centimeters across, in adult men, and it's part of the male reproductive system. It sits just below the bladder, in front of the rectum, and surrounds the upper part of the urethra. Its main job is to produce a fluid that nourishes and protects sperm, making up part of the semen. The walnut-sized comparison is most accurate for healthy young to middle-aged men. It can enlarge with age, especially due to benign prostatic hyperplasia, BPH. Cancer in the prostate develops when cells in the prostate gland grow uncontrollably, and while the science has not yet discovered the actual or definitive reason for its development, research has identified several factors that increases the likelihood of it occurring. These factors can be grouped into biological, genetic, environmental, and lifestyle-related influences. 1. Genetic and family history. Inherited mutations in genes like BRCA1, BRCA2, and HOXP13 can increase risk. Having a father, brother, or son with prostate cancer roughly doubles the risk, and the risk is higher if relatives were diagnosed at a young age. 2. Age. Risk increases sharply after age 50. Most cases occur in men over 65. 3. Race and ethnicity. More common and often more aggressive in African American and Caribbean men of African ancestry. Less common in men of Asian descent. 4. Hormonal factors. Prostate cancer growth is influenced by androgens, male hormones like testosterone and dihydrotestosterone. Abnormally high levels or increased sensitivity to these hormones may promote tumor growth. 5. Lifestyle and diet. High-fat diets, especially with lots of red or processed meat, may increase risk. Low intake of fruits, vegetables, and fiber may contribute. Obesity has been linked to more aggressive forms of prostate cancer. 6. Environmental and occupational exposure. Exposure to certain chemicals, for example, cadmium, pesticides, Agent Orange, has been associated with higher risk. Possible links with air pollution and other industrial exposures are still being studied. 7. Chronic inflammation and infection. long-term prostatitis, inflammation of the prostate, or certain sexually transmitted infections may contribute to DNA damage and cancer risk. 8. Random cellular changes. Sometimes, cancer develops from random DNA mutations during cell division, without a clear outside cause. That would make it easier to prioritize prevention strategies. Now, who needs to pay extra attention? Because this isn't just about age anymore. About 6 in 10 prostate cancers are found in men older than 65, but the chance of having prostate cancer rises rapidly after age 50. This is where it gets serious. African American men and Caribbean men of African ancestry develop prostate cancer more often than men of other races. African American men are nearly 80% more likely to be diagnosed with prostate cancer. Having a father or brother with prostate cancer more than doubles a man's risk. If multiple family members had it, especially if diagnosed young, your risk skyrockets. Here's a real wake-up call. I know a family where the grandfather died of prostate cancer at 72, the father was diagnosed at 58, and now his 45-year-old son just started screening early because of this family history. That son. He caught a small tumor early and is now cancer-free after treatment. 3 generations, 3 different outcomes, all because they learned from their family's experience. Geographic factors: men living in North America, Australia, Northwestern Europe and the Caribbean islands are at higher risk, and scientists still don't fully understand why. The critical ages you need to remember. Age 50, average risk men should start screening discussions. Age 45, high risk men, African American, family history, should start screening. Age 40, men with genetic mutations or multiple affected family members should consult their physicians for screening. Here's where you take control. While you can't change your age, race, or family history, there are things you can do. Diet and lifestyle. Maintain a healthy weight. All patients with cancer who are overweight or obese should limit their intake of calorically dense foods and beverages, as well as increase their activity to lose weight. Some studies suggest foods high in lycopene, tomatoes, watermelon, may help. Regular exercise isn't just good for your heart, it's protective. Here, let us bust some myths. Frequent ejaculation and prostate massage have not been shown to reduce your risk, despite what you might read online. Early detection saves lives. This is the most important part of this entire video. Early detection is literally the difference between life and death. The 2 main screening tests. 1. PSA blood test, a simple blood test that measures prostate-specific antigen, PSA, levels. This is the gold standard and primary screening tool. 2. Digital rectal exam, DRE, your doctor checks for bumps or hard areas in your prostate through the rectum. Here's exactly when you need to start screening. Age 50, start discussing screening with your doctor to eliminate the risk factor. If you're higher risk, start earlier. Age 45 for African American men or men with a first-degree relative, father, brother, son, diagnosed before age 65. Age 40 if you have BRCA2 mutations or multiple family members with early prostate cancer. How often should you get tested? Here's what the experts say. Every 2 to 4 years for men aged 50 to 69. Every 2 years if your PSA is under 2.5. Yearly if your PSA is 2.5 or higher. After age 70, discuss with your doctor based on your overall health. Understanding your PSA results. Less than 1 nanogram per milliliter, normal, retest in 4 to 5 years. 1 to 3 nanograms per milliliter, above normal, retest in 2 to 4 years, 2 years if closer to 3 nanograms per milliliter or higher, well above normal. Talk to your doctor about repeat testing and possible additional tests. Advanced screening when needed. If your PSA is elevated, don't panic. Your doctor might recommend MRI of the prostate for better imaging. Additional biomarker tests like PCA3 or fork score MRI fusion guided biopsy, much more precise than older methods. Why many men avoid this? The digital rectal exam isn't pleasant, and is embarrassing. But guys, we're talking about 30 seconds of discomfort and embarrassment versus potentially saving your life. Which would you choose? Let me share what one survivor told me. I was embarrassed and kept putting it off. Finally, my wife literally drove me to the appointment and waited in the parking lot to make sure I didn't chicken out. That embarrassing 30-second exam saved my life. Now I tell every guy I know, your pride isn't worth your life. The shared decision-making approach. Here's something important. The medical community now recommends shared decision-making. This means you, your family, and your doctor discuss the benefits and risks together. You're not just told what to do, you're educated about your options so you can make the best choice for your situation. Treatment options and success rates. Now for the really good news. If you're diagnosed with prostate cancer, your treatment options are better than ever before. Treatment options include 1. Active surveillance, for slow-growing cancers, very advanced age, poor health condition. 2. Surgery, radical prostatectomy. 3. Radiation therapy. 4. Hormone therapy. 5. Chemotherapy, for advanced cases. 6. Immunotherapy, cutting-edge treatments. Which treatment is best for you is decided by the doctor depending on your cancer stage, medical condition, overall health, age, etc. Of course, your family will be part of this decision-making. The success rates will blow your mind. Localized cancer, nearly 100% 5-year survival rate. Regional cancer, 100% 5-year survival rate. Overall, 5-year survival rate is 97.9% even with distant/metastatic cancer. The present 5-year survival rate is about 32 to 38% and improving, and with new treatments, many men are living years longer than ever before. I want you to meet David virtually. He's a 68-year-old teacher who was diagnosed with aggressive prostate cancer 3 years ago. He chose robotic surgery, went through a tough recovery period, but today he's back to hiking with his grandkids and just celebrated his 40th wedding anniversary. He says the hardest part wasn't the treatment, it was making the decision to get screened in the first place. Life after treatment. Let's be real about life after treatment. It's not always smooth sailing. Common side effects: urinary dysfunction, affects about 20% of surgery patients. Sexual dysfunction, can affect up to 79% initially, but many men recover. Function. Bowel problems, especially after radiation. Fatigue and emotional changes. The good news: many side effects improve over time, and there are effective treatments for most complications. Most doctors recommend PSA tests about every 6 months or so for the first 5 years, and at least yearly after that. The key is having a good support system, and staying on top of your follow-up care. Here's what gives me hope. I've met countless men who've not only survived prostate cancer but say it changed their lives for the better. They prioritize their health now, spend more quality time with family, and many become advocates helping other men face their diagnosis with courage. One survivor told me, "Cancer didn't defeat me, it taught me how to truly live." Here's what I need you to do right now. 1. Know your screening age, average risk. Start discussing at 50 African American or family history. Start at 45 high genetic risk or multiple family members affected. 1. Start screening at 40. 2. Schedule your appointment. 3. Don't wait for symptoms. Remember, prostate cancer often has no early symptoms. The only way to catch it early is through screening. 3. Get your baseline PSA, Even if you're younger than the recommended screening age, knowing your baseline PSA level can be valuable information for your doctor. 4. Know what questions to ask. Oh, what's my PSA level and what does it mean? Oh, based on my family history and risk factors, when should I be screened? Oh, what are my options if my PSA is elevated? 5. Share this video. Send it to every man in your life who needs to see this. Your father, brothers, sons, friends, co-workers. 6. Start the conversation. Break the stigma. Men don't talk about this stuff enough, and that silence is literally killing us. 7. Know the symptoms: difficulty urinating, urinary tract infection, UTI, blood in urine, bone pain, unexplained weight loss. But remember, early prostate cancer usually has no symptoms. The bottom line: screening programs prevent deaths from prostate cancer. Cancer mortality has dropped by 34% since 1991, averting nearly 4.5 million deaths. Prostate cancer doesn't have to be a death sentence. With early detection and modern treatment, most men go on to live full, healthy lives. But only if they take action. Don't let the next statistic be you or someone you love. Knowledge is power. Early detection saves lives. And today, you have the power to change your story. If this video could save even one life, it is worth making. Hit that subscribe button if you want more life-saving health contents, and remember, your health is your wealth. Take care of yourself, gentlemen. Your family needs you around. Medical disclaimer important: this video is for informational purposes only and is not intended as medical advice, diagnosis, or treatment. The information provided should not be used to replace professional medical consultation, diagnosis, or treatment. Key points: always consult with qualified healthcare professionals before making any health-related decisions. Individual cases vary significantly, and treatment outcomes cannot be guaranteed. The statistics and survival rates mentioned are based on large population studies and may not reflect individual experiences. Screening recommendations may vary based on personal and family medical history. Never delay seeking professional medical advice because of information you've seen in this video. If you're experiencing symptoms or have concerns, contact your healthcare provider immediately. Sources: information compiled from the American Cancer Society Cancer Facts and Figures 2025, National Cancer Institute SEER database, and peer-reviewed medical journals. The stories shared are generalized examples based on common patient experiences and are not specific individuals. They are intended to illustrate typical scenarios and should not be considered medical testimonials. Remember, this video encourages medical screening and professional consultation. It does not provide medical diagnosis or treatment advice. Your health decisions should always be made in partnership with qualified medical professionals who know your complete medical history.